Knowing that frontline staff want to provide excellent service when confronted with potentially difficult conversations, the next section offers some suggestions and tools around how to navigate this challenge. We talked to CCO customer service representatives and asked them to tell us about their most challenging situations. We use that information in the creation of this content. Though this section is framed from a CCO perspective, conversations like these happen across the community. The communication tools demonstrated in this section can be translated for use in other settings, like medical clinics or community service organizations.
So many of you may have questions about what's happening in the next few months around what we're calling the 90 MED shift. And Kelsey and I are going to be having a conversation based on our experience working in a clinic with people who were often being asked to taper down or off of their opioid medication.
So Laura, in simple terms, what does the 90 MED shift mean?
So basically, what's going to happen is that any patient who is currently being covered by a coordinated care organization Medicaid plan is going to be receiving a letter, and they're going to be contacted by their doctor's office, and they're going to be asked to reduce their morphine equivalency dose of prescription opioids. What's happening is that we have 4 coordinated care organizations, and we're all going to be working together to roll this forward so that all of our patients and all of our members are receiving the same message.
So Kelsey, can you tell me what types of non-opioid treatment options are available for our members and patients?
Well, this varies from CCO to CCO. There is a tool called the Benefit Crosswalk Opiate Alternatives, which highlights all the options. This tool is available to CCOs and providers. So Laura, when someone calls and they're scared or upset about the change, how can I best help them?
So Kelsey, I think the most important thing to do is to validate a person's experience of what they're going through. I think we need to recognize that for many of our patients and members out there that have been using prescription opioids for a long time or have come to rely on them very deeply, that this can be a very scary change. So the first thing would be to validate their experience of whatever emotion they're having. Maybe they're afraid, maybe they're angry, concerned, and then to really ask them, how could you support them? What is it exactly that they are needing, or what is the question that they have for you?
So Laura, how do I validate them when the member is expressing blame towards the CCO or their provider?
What's important to remember is that you do not need to apologize for this change that's happening. It is about safety, and ultimately it is in patients' best interest to be reducing on these medications. So again, you can validate a patient's experience of whatever emotion they're having without having to apologize for the change that's happening.
So Kelsey, what about somebody who's calling in and clearly they're in withdrawal or they're going through some kind of a detox? What would you suggest of how you might handle somebody in that situation?
Well, the approach is the same, to validate their experience and express your concern, knowing that with this shift, it's not uncommon that patients are going to be experiencing some uncomfortable symptoms. What you'll want to do is be sure to take their concerns and notify the appropriate clinical staff. You may need to connect them with local resources like their medical provider, a clinical pharmacist, or even a helpline.
So Kelsey, how would you recommend that somebody compassionately end a phone call with somebody when somebody is clearly upset and maybe going on and on?
Well, continue to validate the member's experience while still setting limits.
Let's say I'm the person on the other end and I'm very upset and I'm going on and on. What would you say? How would that look if you were just going to end the call? And wouldn't that be mean?
I would probably say something like, Laura, I hear that this is really challenging and I want to help you. Right now, the best thing I can do is end this phone call so that I can notify your provider of what's going on and someone will follow up with you as soon as possible.
And what if they wouldn't stop talking? what would you do then?
Then again, it's important to remember that limit that you're setting and go ahead and hang up the phone and make sure to follow up with your supervisor.
So Kelsey, we talk a lot about validating, and can you tell me a little bit about what does that really mean? What does that look like in the real world?
Yeah, great question, Laura. It might be best to actually practice expressing that validation. Why don't we go ahead and do a role play right now where you pretend to take on the role of the patient and I'll be the person receiving your phone call.
Okay. Kelsey, I just got this letter in the mail and I don't know what to do. I'm in so much pain, and this letter is saying that I'm going to have to reduce my pain medication, and I can't live without my pain medication. So I need you to help me. I need you to do something. Can you do something for me? Because I'm not going to be able to live without it.
Yeah, Laura, I would really like to help you. It sounds like that letter has caused some confusion and maybe even some fear for you about what might happen around your medications.
Yeah, I'm very afraid.
Yeah, absolutely. Now, have you contacted your primary care provider?
Well, no, because I thought I would just call you first because I can't ever get through to them, and I was certain it was a mistake, so I thought I would just call you first because I'm sure that you'll be able to help me.
Oh, of course, Laura. I'm glad that you called me, and I would love to help you. One of the things that we'd like you to do is contact your primary care provider directly. They're really going to be able to help you make more sense of this and understand how this is going to look for you.
Well, I don't know. I'm in a lot of pain.
Yeah, I hear it's probably very painful. Is there anything specific that I can help you with?
Well, I guess I wonder if I call my doctor's office and I can't get a hold of him, would it be okay if I called you back?
Absolutely. If you have trouble reaching your doctor's office, please give me a call so that I can help you with that.
Thank you.
So Laura, where can I go to read and learn more about this topic?
Well, all of the CCOs will have information on their website in this area. Also, the Center for Disease Control has an amazing website with some really great tools if you want to learn about what's happening across the nation. Locally, we have the OregonPainGuidance.org website, which is also very informative, and you can learn a lot more about what's happening locally.